So let's delve into the triceps. One of the ways I like to do the triceps is if we can bring the arm up. We can either just rest the arm in that position, or we could ask the patient to put their hand behind their head. The reason I like this position is because we are now opening up that space, we're now stretching that area, and we can actually really get into that muscle and really release quite a lot of tension. At times you wouldn't do this though is if somebody has got a shoulder condition where obviously bringing the arm into this position is going to be painful. We're going to do stationary cupping to start with, followed by massage, and then you can do some pin and stretch as well. Stationary cupping, if you think about the triceps run down the back of the arm. We have 3 triceps, hence the name tri, medial, lateral and medial. So we want to try and work along this line here, so where the olecranon is, and line down that lateral side, okay? Try not to, even though the arm is in this position, try not to come down the medial side. We want to be coming down here, okay? So with regards to the same as any cupping technique, you want to make sure that you're using the cup size that's going to suit your patient. So if your patient has got quite large arms, you're going to go for a larger cup, as opposed to somebody that's got quite slender arms, obviously you're going to go for a smaller cup. But also, as I've mentioned previously on other arm videos, we do have that curvature, that natural curve to the arm. So you need to make sure that the cup is going to fit nicely, otherwise it's just going to keep popping off. So we're going to start with one a bit further down. We're going to go in here. So I've actually used a small-ish cup just here. Just going for one pump. And then I'm going to go for a slightly smaller one again, down beneath that. And then same again beneath that if I can. Perfect. Excellent. So just checking there on. So that's the line in which I would do for triceps. You can obviously, if you're wanting to get more of the medial arm or the lateral arm, obviously we can start to go round, and at that point you may want the patient in more of a prone position. But as mentioned, I do quite like this position purely because it really does open up that space a little bit more, because we're already putting the area on stretch, if your patient can cope with this position. With regards to massage, obviously once we're happy with the stationary cups, we're now going to get the massage medium if you haven't already loosened off the area. So we're just going to gently start to massage, and as you can see, I'm supporting the arm by scooping my fingers round, and I'm really gently just loosening off at the moment. Just palpating. A little bit of massage, so it's a little bit tight through there, so I'm assuming when we use the cups it's going to get a little bit tight through that spot. Excellent. So I'm going to use a small cup because we're going to be going from, whilst this area could possibly go with a slightly bigger cup, this area can't. So because we're moving up into this area, rather than using 2 different cups to do the massage with, I'm just going to stick with the one. And I'm just going to go really slowly through those areas. I've got a nice light pressure through there at the moment. Just working through all those tricep muscles. You okay?
Yeah, that's fine.
Watching my patient's face, making sure they've not got the poker face on. There we go. It actually feels a little tight through there. Yeah, and it's going a little red. So I'm just going to leave that one on there. As mentioned before, what I can do is I can leave that one in the areas that are a little bit tight. I'm just going to put a little bit more on. Try not to take it off completely. There we go. And then I could use another one. And because the area is a little bit longer, I should be able to get away with having 2 on that area. But I'm just going to support the one that's staying still so that we don't cause any added strain and end up pulling it off. There we go. So it's a little tight there. So I'm actually going to do a bit of a fascial pull, something that we did in the back example and the legs. where we can hold on to the two and start to gently pull them apart. So I'm actually starting to work on the fascia between those two points now. Excellent. Happy with that. So when we do the pin and stretch, ultimately what we're trying to do is we're trying to lengthen through that muscle. Now remember, when we're in this position, we're already at a lengthened position through the triceps. So we're not going to really need to do much of a movement. It's really just getting some movement through that area. So we found that there was a little bit of a tight spot just here. So I'm going to put a cup just there. And then what I'm going to ask my patient to do is simply extend. Move her head so she's looking away, that's it. And then just bend and extend the arm. Okay. Now, if the patient is in a prone position, so facing down, so you can relax there for me a second. So if they're in a prone position, you've got the cup on, you'd want to drop the arm off the bed and then you go into that flexion through the elbow. Ultimately what we're trying to do is bend the elbow because the tricep extends, so we want to try and add in flexion. Okay, but because we've already got that stretch through in this position, which works really nicely, we don't need to worry too much about getting too much of a stretch in that area. Of course, if you really want to stretch the area, you can get them seated, put the cup on in that position, and then do a stretch in that position there. So it really depends on how much you want to stretch that area, but the principle remains the same.